Hello everyone, I am Dr. Mona Parmar and welcome to my channel Homeonest. So today I am going to discuss a topic and that is vertigo. This is a condition, it's a clinical condition which is commonly seen in our practice. In this, the most commonest one is benign paroxysmal positional vertigo. Now what is this huge terminology? So let me explain you each and every word which can make it more simpler for you to understand. So when I talk about benign means it's not dangerous, it's absolutely harmless. When I talk about the second word, and that is paroxysmal means it is sudden and it is very frequent. Positional vertigo, if I talk about, positional means it depends on the position of your head. The movement of your head can cause vertigo. Upward, downward, sideways movement, sudden jerking movement. Somebody's called you from behind and you turn back and you get a sudden vertigo. Now, as you all know, that vertigo is nothing but a loss of balance, a sensation of loss of balance. There is a sensation where there is a lot of spinning in the head. So it can happen that it can be for few seconds or it can be for several minutes. So in this condition, the patient feels that everything around himself is revolving and there is some spinning in his head. This can happen due to variety of reasons or various reasons. Let's talk about these reasons. So first and foremost, understand one thing, that what is this imbalance. For that we need to understand how the balance of our body is maintained. So firstly, our balance or the body's balance is maintained through ears. So our ears are also called as the balancing organs. Now in the ear, inside the ear, in the inner ear, there is an organ which has fluid in it, and there are sensory hair-like particles which transmit the sensation to the brain, and that helps in balancing our body. So this is about the balance organ. Now what happens when there is imbalance? What is the cause? So what happens is that when this kind of imbalance happens or when this vertigo happens, there are certain calcium carbonate crystals in the inner ear. They are normally present in the inner ear. Now when they get dislodged or they get separated from their position, and when they go into these canals which are present in the inner ear, and when they flow along with the fluid, they cause vertigo. So when you get such kind of spinning sensation, it is because of these crystals which have got dislodged in the fluid, and that causes vertigo. Now why do these crystals get dislodged? It can be either due to a head injury, or it can be due to infection in the ear, or third thing is it can be age related degeneration. Okay, now the thing is, we would discuss today about the most commonest condition or the most commonest cause in our practice, and that is ear infection. Now how does this ear infection happen? Now the ear infection can be due to a long lasting cold. If you have cold since many days and the cold is not subsided or it is not being treated properly, that can be one reason. Another reason is that you had a head bath and you did not bother that the water has gone inside the ear. It has caused an infection. Third thing is that you had a very chilled cold drink and you had it completely, and that has caused infection in the ear. That is another thing. Another thing is that you are traveling outside, you are traveling in a bus, open bus, or you are traveling in a rickshaw, and there is draft of air, cold air, which is gone inside your ear. Probably your ears are very sensitive, and that's the reason why you catch a infection. So these are the most commonest conditions which we see in our regular practice. So now, if this condition has happened, now what do we do for this? As I told you about the condition where we take a bath, we take head bath, and the water has gone in the ears, and say for example this condition happens very frequently. You had a head bath and you get, after maybe few minutes or few hours, you are getting vertigo. That means the most commonest cause in your case is head bath, where your ear is filled with water and you have not realized, and that has caused infection. So the best thing is that when you take a head bath, you take a cotton plug, put oil on one side of the cotton plug, and put that cotton plug, the oily side, inside your ear. So when you take a head bath, the outside cotton, even if it gets wet, the oil inside the cotton, the inner side, will not allow the water to enter in the ear. So your ears will be protected. Another thing is that if you have a cold drink and your cold drink is very, very cold and you actually didn't want to have, but you have to go somewhere and you want to have that cold drink, you can take little warm water and put your cold drink. If it is very cold, you can put that cold drink in that warm water utensil and make it little warmer. So that is another thing. While traveling, if you get cold draft of air, you should always plug your ear with cotton so that it doesn't allow the air to enter. So now these are the few tips which can be used if you have such kind of conditions. Now if I talk about homeopathic way of managing this condition, two remedies which are very, very important in such kind of conditions are conayum and gelsemium. These two medicines have been very useful in such kind of spinning condition, in such kind of dizziness and vertigo. So conayum 1000 C and gelsemium 1000 C, easily available in the homeopathic pharmacy. These medicines, when you buy pills in a pills form, what you have to do is, say for example, now you take 4 pills of conayum 1m or 1000, it is said. You take it now, 4 pills. After 15 minutes, take gelsemium 1000. And similarly, you have to do it if the vertigo is very, very intense, or the positional vertigo is very intense. Then you can take this medicine every hourly, that is 1 hourly. But you have to do the same combination. First conayum 1m, after 15 minutes you take gelsemium 1m, and after 1 hour again same way conayum and then gelsemium. You can take this for say few doses until you are better 90%. Once you start becoming better, you can taper it off or stop it, and then you can consult your homeopathic physician for the further understanding of the case, because if you are getting it very frequently, you need to understand why you are getting it very frequently, and then this kind of condition can be completely cured only through constitutional method of treatment, and that is the complete holistic method of treatment, wherein we take the whole case of an individual, we understand the personality of the individual and then prescribe on the basis of it. So if you like my video, give a like, share it with people whom you feel that they would need this kind of advice, and please subscribe to my channel for more such videos. Thank you so much for watching.